Hello and welcome to Riverside's Doc Talk. Today, in honor of Stroke Month, Dr. Sathish Mohan of Riverside Vascular Specialists is joining us to speak about the important connection between vascular health and stroke prevention. Dr. Mohan?
Good afternoon. My name is Sathish Mohan. I'm one of the vascular surgeons here at Riverside Hospital. And as part of Stroke Awareness Month, I'd like to talk to you a little bit about stroke and a procedure we're now doing called Trans-Carotid artery revascularization. Quickly, a little bit about stroke. So stroke is basically a brain attack in that there's a lack of oxygen flow to the brain, which then leads to either injury or death of brain cells, which then leads to a neurologic deficit. Technically, a stroke is defined by a deficit that lasts more than 24 hours. And a mini stroke is a deficit that lasts for a shorter amount of time, but then eventually resolves. Currently, stroke accounts for about 1 out of every 18 deaths in the United States and ranks 4th among all causes of death behind other cardiovascular disease, cancer, and respiratory disease. It's the leading cause of long-term disability in the US. It can be both ischemic or due to a blockage of a blood vessel, or hemorrhagic, which is basically bleeding into the brain. Now, the area we'd like to focus on today are the arteries that are bringing blood to the brain, and specifically the arteries in the neck called the carotid arteries. The carotid artery has an area where it gives off a large branch called the external carotid artery and splits to form the internal carotid artery, which then goes into the brain and provides blood flow to the brain. And that area where it branches can be an area of turbulent flow of blood, which then ultimately leads to narrowing of that segment. And this narrowing, if it gets severe, can then lead to small pieces of plaque or cholesterol buildup in that area, which can then break off and go to the brain and cause a stroke. So we're particularly interested in this area because we want to find these narrowings if they're very severe and treat them before they cause a stroke. So like I mentioned, these areas of narrowing can lead to a small ulceration, which then leads to buildup of platelets and blood products, and then that can break off and go to the brain and cause a stroke. This is the most common way of a stroke occurring. However, there are situations where there's severe narrowing of both sides of the neck arteries, and that leads to significant decrease in blood flow to the brain itself, and that can also cause a stroke on some occasions. Now, the first procedure I'd like to talk about is one that we've been doing as vascular surgeons for 50, 60 years now, and this is called a Carotid Endarterectomy. This is a procedure where the patient's generally under anesthesia. We make an incision along the neck and we dissect down to the artery. We control the artery and we make an incision and scoop out all the plaque and put a patch on it and close the artery up. So these are some operative pictures. If you can see on the left side, this is an artery with a little shunt inside it so that blood flow can occur while we have the rest of the artery closed off. And in between that area, you see this white thickened area that's the plaque. And we're slowly peeling that out. And you can see on the right side that plaque is then lifted. It's cleaned in the middle image. And then the patch is sewed in place to cover up the hole after everything else is removed. And then eventually the patient is closed back up. And the goal here, it's essentially a preventative surgery to avoid a repeat stroke or a first-time stroke in situations where there's significant narrowing of the blood vessel. Like any other surgery, there are some risks associated with this, some risk of bleeding, infection, small risk of stroke during the surgery itself. Usually that's pretty low, on the order of 1% to 2%. And there are some nerves that run in that area that can sometimes be a little irritated or injured due to retraction or injury during the surgery. But overall, these risks are fairly low. So typically, for patients that have narrowing above 80%, we talk about surgery to fix this, or in patients that have mini strokes or strokes and have a narrowing above 50% narrowing. Now, a newer procedure that we've been doing is called Trans-Carotid Artery Vascularization, and it's kind of built upon both carotid endarterectomy and carotid stenting, which was previously done from access from the groin artery or the femoral artery. In this surgery, we're able to connect between a small incision made in the neck, and we put in a surgical cannula into the carotid artery, and we actually reverse the blood flow. So that instead of going up to the brain, it's now coming down from the brain. And we filter the blood through this connection, and then we return the blood through the veins. And so this is a novel technique in that we're now able to reduce the risk of stroke during the procedure itself, because if anything breaks off or something comes loose, it comes down into the filtration circuit and does not get sent up to the brain and cause a stroke. Essentially, what it is we make a small incision at the base of the neck. We dissect out the common carotid artery, and we put in the cannula. We then cross the lesion after having set up the circuit, and then we use a stent to open up the area and balloon it open. And during the ballooning, if anything breaks off, it'll again go through the circuit and not up to the brain. We do make sure that patients are on the appropriate medications beforehand. This includes both an aspirin and Plavix typically for at least a couple of weeks before the procedure starts. Statin medication for cholesterol. While statins also lower cholesterol, they also help stabilize any existing narrowings. And so we load patients with statins. And then we thin the blood during the procedure itself to make sure there's no clot or anything else, because we do have catheters and wires within the blood vessels. So this is a picture of showing where we make the incisions, usually just below the ear, right above the collarbone there. We dissect out the artery, we connect the two, we take a picture, and then we ensure that we have the correct positioning of the stent, and then we deploy the stent. Afterwards, we just reverse the steps by disconnecting the connection, and then we close up the hole that we made in the artery and close up the incision on the skin. So most patients tolerate it really well. It's typically a one-night stay in the hospital, and it's usually very small incision under the collar, so you can't even see the incision when it's all healed up. There have been several studies that looking at both feasibility and safety and effectiveness of Tcar, and in general, they've had excellent results. With the initial study looking at this, there were 141 patients and very low risk of major adverse events with either death or stroke or heart attack. So Tcar risk of stroke, like I mentioned, is about 1.1%, if not lower. Otherwise, it's very equivalent to carotid endarterectomy. Overall, I think we have some excellent therapies to offer patients that have risk of stroke or narrowing of their carotid arteries. And I would urge you to speak with your healthcare provider or come see us to answer any questions, or if you do have carotid disease and would like to talk about treatment. Thank you very much.